The facial nerve is a complicated nerve. It's composed of 4 components of fibers. So it takes origin from 4 nuclei in the brain stem. It contains sensory, that is general sensations from the middle ear. It contains special motor supply for the muscles derived from the second pharyngeal arch, which are the muscles of facial expression. I'm sure you have studied these in your embryology. The second pharyngeal arch gives rise to muscles of facial expression and auricular muscles and few other muscles, and all these are supplied. The nerve of second pharyngeal arch is the facial nerve. In addition, contains preganglionic parasympathetic fibers from a parasympathetic nucleus in the brainstem, and contains taste fibers for the anterior 2/3 of the tongue. Remember, from the nerve supply of the tongue, the anterior 2/3 taste buds are supplied by the facial nerve through its chorda tympani, which you have seen it, joining the lingual nerve of mandibular, and then supply the anterior 2/3 of the tongue. So the 4 components are the general somatic afferent, that is sensory, with special somatic efferent, motor for the muscles of second pharyngeal arch, special visceral efferents, that's preganglionic parasympathetic fibers for salivary glands, and contains special visceral afferent fibers, that is the taste fibers. So the facial nerve should take fibers from neurons in different nuclei. In brainstem nuclei, the sensory is taken from the sensory nucleus of trigeminal, few fibers. The special motor efferent for the second pharyngeal arch is taken from the motor nucleus of facial, which is situated in the upper part of medulla. It takes also the preganglionic parasympathetic fibers from the superior salivatory nucleus, and it takes the taste fibers from gustatory nucleus. All these fibers, when they become in a single bundle of fibers with 4 components, they form the facial nerve, which emerge from the brainstem, and then inside the brainstem, the facial nerve, before it emerges to the outside, it curves in the inside the brainstem around the nucleus of abduced nerve, where it forms a band. A band is formed, and this band which is called genu. This we call it internal genu of the facial nerve. Takes a course inside the brainstem, and then emerge together with the vestibulocochlear nerve, that is the 8th cranial nerve. Together they emerge between pons and medulla oblongata. Now the facial nerve, it has a complicated course. In this schematic diagram, now is slide number 34, is it with all of you? Now this is a schematic diagram to show the course of the and branch of the facial nerve. It has a complicated course. Sometimes in books, is described the facial nerve as a story, just like the story of Alice in the wonderful world. Alice في بلاد العجائب. تفوت منا ومنا دهاليز. The same thing is for the facial nerve. Now, as I said, the facial nerve emerges from the junction of pons and medulla, accompanied by the vestibulocochlear nerve. The two emerge as single nerve, and then they enter, both of them, they leave the cranial cavity by passing through internal acoustic meatus. In this diagram, this portion on the top left, Is it clear, the slide, for all of you?
Yes, doctor, it's clear.
So on the top left here, this is the middle ear cavity. This is the petras part of temporal bone. Petras part of temporal bone. Here is the mastoid process, the mastoid process. This is the internal acoustic meatus. And this is the petras part of temporal bone. This is the carotid canal, which contains the internal carotid artery with the sympathetic plexus surrounding it. And this is the middle ear cavity. And the rest is petras part of temporal bone. This is the internal acoustic meatus. This passes into what is called the canal, a bony canal inside petras part of temporal bone. This is the bony facial canal. This is the bony facial canal. You see it's an S-shaped. It lies in the posterior wall of the middle ear cavity. In the posterior wall of middle ear cavity, and then continues as stylomastoid canal to open in the base of the skull as the stylomastoid foramen. So here is the stylomastoid foramen. This is the bony facial canal, which is an S-shaped canal. This is the carotid canal, which contains the internal carotid artery with the sympathetic plexus surrounding it, and this is the middle ear cavity, which all lies within petras part of temporal bone. This is the mastoid process. Now the facial nerve enters course of it. It enters inside the internal acoustic meatus, and then pass in this S-shaped bony facial canal in the posterior wall of the middle ear cavity, descending toward the stylomastoid canal, or emerge from stylomastoid foramen behind the styloid process, and then it descends downward here. This is elongated, it's not like this, because it's here in the lower left. The facial nerve emerging from stylomastoid canal here, it enters, curves behind the posterior border of ramus of mandible, and enters inside the parotid gland. Here it enters inside parotid gland. You have seen that one of the intraglandular structures of the parotid, non-glandular, inside the parotid was the facial nerve. And the facial nerve here within parotid divides into its 5 terminal branches for the supply of the muscles of the face. This is the course of the facial nerve, the main trunk of the facial nerve. Now, as I said, it contains 4 components. Sensory component. Now, the sensory component of it in its course in the bony facial canal, in this S-shaped canal, it passed through the ganglia. The ganglia, which is a collection of neurons outside the central nervous system, which we call it nucleus inside the central nervous system. This is a sensory ganglia. Now, the sensory supply of it emerged from the ganglia, gives rise for sensory nerves for the supply of the middle ear cavity and part of the external acoustic meatus. Small few twigs for the supply of the middle ear cavity sensory. Now, branch of the facial nerve. So the first one are the sensory for the middle ear cavity. Now next we said that it contains preganglionic parasympathetic fibers. These are the preganglionic parasympathetic fibers. Now at the geniculate ganglia, they bypass it. Some of these they leave the nerve as the greater Petrosal nerve. It's branch as greater Petrosal nerve. This greater petrosal nerve emerged from a hiatus in the anterior wall of the petras part of temporal bone and enters in the middle cranial fossa. This is called greater petrosal nerve. So it carries preganglionic parasympathetic fiber emerging from the petras part, foramen, in the anterior wall of petras part of temporal bone. It passes in the floor of the middle cranial fossa and then become joined with another branch from the sympathetic plexus around the internal carotid artery, this orange one. The two unite with each other. The two unite with each other in the floor of middle cranial fossa, and they form what is called, this branch from the sympathetic plexus is called deep petrosal nerve. With the great petrosal from the facial, the two become one nerve enclosed in one sheath, and one sheath is called nerve of pterygoid canal. This nerve of pterygoid canal, it passes through a bony canal and enters in the Pterygopalatine fossa to terminate in the Pterygopalatine ganglia. Pterygopalatine ganglia, which is connected to the maxillary nerve we have seen. These are branches of maxillary nerve. This greater petrosal terminates on the neurons of this Pterygopalatine ganglia. Postganglionic parasympathetic fibers from this Pterygopalatine ganglia distribute with the maxillary nerve for the supply of lacrimal gland through its maxillary branch, secretomotor for the lacrimal, and for the glands of the nasal cavity, the nasopharynx, the roof of the oral cavity, and all superior alveolar arch with the soft palate, hard palate, that is roof of oral cavity, and the nasal cavity with the nasopharynx and the lacrimal gland. So this is the greater petrosal nerve, takes part of the preganglionic parasympathetic fibers, not all of them. Some of them continue with the facial nerve here. This is greater petrosal nerve emerging from a hiatus in the anterior wall of the petras part of temporal bone, then passes in the floor of middle cranial fossa to be joined by another nerve from sympathetic plexus around internal carotid artery. The two unite with each other and form the nerve of pterygoid canal. The sympathetic is postganglionic sympathetic. We call it deep petrosal nerve. Together with greater petrosal, they become nerve of pterygoid canal, which pass to the end in the Pterygopalatine fossa and terminate in the Pterygopalatine ganglia. The sympathetic part, the deep petrosal, this bypasses the ganglia, and then they distribute together with the branch of the maxillary nerve, which you have seen forms four groups. The zygomatic for the supply of lacrimal gland, then you have pharyngeal for the nasopharynx, nasal for the nasal cavity, orbital for the floor of the orbit, palatine for the roof of the oral cavity, and the upper alveolar arch, that is the hard palate and the soft palate. So by now, from the facial nerve, we have the sensory part for the middle ear here and part of the parasympathetic. What remains from here is part of parasympathetic, taste fibers, and the motor fibers for the second pharyngeal arch muscles, passing in the stylomastoid canal, leaving the facial. Just before it emerges from the stylomastoid foramen, it gives rise to another branch, which is the chorda tympani. The chorda tympani nerve. The chorda tympani nerve, this nerve carries the rest of the preganglionic parasympathetic, that is what remains of the greater petrosal. Some of them remains, as I said, these, they pass in the chorda tympani. In addition, the chorda tympani takes all the taste fibers of the facial. So the chordae tympani is a two-component nerve, preganglionic parasympathetic fibers together with test fibers. Now the chordae tympani emerging in the stylomastoid canal, it enters through an anterior posterior canaliculus inside the middle ear cavity. It passes above the tympanic membrane. Sometimes if you examine the ear by oroscope, you can see the chordae tympani nerve above the tympanic nerve, passes from the posterior canaliculus to enter in the middle ear cavity and then leaves the middle ear cavity through another opening, which is called the petrotympanic fissure. From this, it enters in the infratemporal fossa, descending infratemporal fossa. We have seen it last week. It joins the lingual branch of the mandibular nerve, passes with it. يركب وياه بصيرون nerve واحد. Now this lingual, if you remember, it passed to the floor of the oral cavity for the supply of the tongue. Now the chordae tympani joins with it, HLB, and these components of chordae tympani then pass in the submandibular region containing two components, parasympathetic, preganglionic parasympathetic, and test. The preganglionic parasympathetic leaves the chordae tympani and end in the submandibular parasympathetic ganglia in the submandibular triangle, just superficial to the hyoglossus muscle. This terminates here. The rest, the test fibers continue with the lingual and pass with it for the supply of test buds of the anterior 2/3 of the tongue. Postganglionic parasympathetic fibers from this submandibular ganglia again supply the submandibular gland and join the lingual for the supply of sublingual gland and floor of the oral cavity and the anterior 2/3 of the tongue. So this is the third branch, sensory greater petrosal chordae tympani. The chordae tympani branch again has two components, test and preganglionic parasympathetic. So two nerves carry preganglionic parasympathetic, the greater petrosal sum, and the rest are carried by chordae tympani. In addition, chordae tympani takes all test fibers, leaves the stylomastoid canal, enters in the middle ear cavity, leaves middle ear cavity above the tympanic membrane, and then enters in the infratemporal fossa, joins the lingual nerve in the infratemporal fossa, distribute with the lingual nerve, reaching to the submandibular region. Preganglionic parasympathetic fibers pass to end in the submandibular ganglia, and the test fibers pass with the lingual for the anterior 2/3 of the tongue. From the submandibular parasympathetic ganglia, postganglionic parasympathetic fibers pass to the submandibular gland, sublingual gland, glands of the floor of the oral cavity and the tongue. So the facial nerve supplies preganglionic parasympathetic fibers to two ganglia in the head and neck, to the Pterygopalatine ganglia in the Pterygopalatine fossa and to the submandibular ganglia in the submandibular triangle. These they supply the lacrimal gland, the nasal cavity, nasopharynx, roof of the oral cavity, and then the submandibular. أحمد شو تريد؟ ألو أنت مو بالمحاضرة؟ أنت مو بالمحاضرة؟ ها؟ أنت مو عندك محاضرة بعد؟ وين كنت؟ نايم؟ يلا. So the facial nerve supplies two ganglia, two parasympathetic ganglia, which gives rise to postganglionic parasympathetic fibers for all the floor of the oral cavity, lacrimal gland, nasal cavity, nasopharynx, roof of the oral cavity, floor of the oral cavity, and two sublingual and submandibular salivary glands. Except the parotid, we will see, is not supplied by these nerve. Now, from the giving the chorda tympani, the facial nerve emerged from the stylomastoid foramen. Descending from the stylomastoid foramen, as I said, here it descends from the stylomastoid foramen, emerge behind the styloid process, and then enters inside the parotid gland, where divides into its terminal branch. Now here are the terminal branch in this schematic diagram. So this portion which emerges from the stylomastoid foramen, it's only contains motor fibers for the special somatic efferent from motor facial nucleus, because the sensory has left to the middle ear, parasympathetic through greater Petrosal and chorda tympani, and the test fibers also through the chorda tympani. So what emerged from the stylomastoid foramen, it's only the special somatic efferent part, and this is for the supply of muscles of second pharyngeal arch. Now, just before here, it enters into the parotid gland. It gives rise to its posterior auricular branch. The posterior auricular branch, from its name, it passes behind the auricle together with the posterior auricular branch of external carotid artery. This supplies the auricular muscles, posterior auricular muscle, and supplies the occipital belly of occipitofrontalis of the scalp. Then the nerve, the motor component of it, divides into 5 terminal branches. Now, if you know from your embryology, the second pharyngeal arch gives rise to all muscles of facial expression, to occipitofrontalis muscle, to auricular muscles, to posterior belly of digastric, and to a muscle of middle ear, which is stapedius muscle. So the facial nerve supplies all these muscles. The nerve to stapedius arises again while it's in the bony facial canal. It emerges from an opening for the supply of stapedius muscle of the middle ear. Then it gives rise to posterior auricular for the supply of occipital belly of occipitofrontalis, the posterior auricular muscle. And then within the parotid divides into 5 terminal branches. And these branches, they emerge from the parotid for the supply of muscles of facial expression. Now the distribution of these, if you put your hand on the side of your face with the palm on the auricle in the ear, your thumb passing upward anterior to the auricle, the index pass toward the angle of the eye, the middle finger pass toward the nose, the ring finger pass over the mandible, and the little finger into the neck below the mandible. These, they represent 5 branches of the facial nerve. The thumb above, and then the index toward the angle of the eye, the middle finger toward the nose and upper lip, the ring toward the body of mandible, and then the little finger into the neck below the mandible. These 5 branches, they are, the first one, the thumb, is the temporals. This might be 1 or 2 temporal branches. This supplies the superior and anterior auricular muscles, supplies the frontal belly of occipitofrontalis muscle, and temporoparietalis muscle. Then we have the zygomatic branch. This passes toward the angle of the eye. The zygomatic, again, might be 1 or 2. supplying the orbicularis oculi muscle with the zygomaticus major and minor. Then we have the buccal branch, which pass over the buccinator, supplying the buccinator muscle and muscles of the angle of the mouth. Then we have the fourth one, the index is the marginal mandibular, which pass along the mandible, along the body of the mandible, supplying muscles of the lower lip and mentalis. And then we have the little finger, which pass into the neck. This is cervical, pass for the supply of platysma muscle. Here are the five branches: the temporal, the zygomatic, the buccal branch, the buccal, the marginal mandibular, and then the cervical branch for the supply of platysma. The cervical branch also gives a branch for the posterior belly of digastric muscle. All these muscles are derived from the second pharyngeal arch, So this is for the components of the facial nerve. Now we are back to slide number 25. Again, the facial nerve, as I said, the components for sensory component, special motor components. This is for the supply of muscles of second pharyngeal arch. Test fibers for the anterior 2/3 of the tongue. And then we have the preganglionic parasympathetic for the two parasympathetic ganglia for the Pterygopalatine ganglia and submandibular ganglia. So it arises from four nuclei for the sensory, from the sensory nucleus of trigeminal nerve, motor from the motor nucleus of facial, and preganglionic parasympathetic from superior salivatory nucleus, and the test fibers from the gustatory nucleus. The course of it, as I said, it's complicated, just like as you have reading Alice in Wonderful World. Course of it, emerging from the nuclei, it forms a curve inside the brainstem, curves around the nucleus of abducens nerve, and it is called internal genome. Then emerge between pons and medulla, accompanied by vestibulocochlear nerve. Both of them, they leave the cranial cavity immediately by passing through the internal acoustic meatus to enter in petras part of temporal bone. Then it passes in the S-shaped bony facial canal in the posterior wall of middle ear. There it forms the geniculate ganglia, the sensory fibers end there. Then it turns downward in the canal to descend in stylomastoid canal to emerge from stylomastoid foramen. Behind the styloid process, enters in the posteromedial surface of parotid gland. Within the gland, divides into its terminal branch for the supply of facial muscles. Now, generally, we have seen that the facial nerve supplies sensory from the auricle near external acoustic meatus and middle ear, motor for all muscles of second pharyngeal arch, that is the muscles of facial expression, auricular muscles, the pedius of the middle ear, and posterior belly of digastric muscle. Next, preganglionic parasympathetic fibers to two ganglia, submandibular ganglia in the submandibular region, and Pterygopalatine ganglia in Pterygopalatine fossa. Then it supplies test fibers from the anterior 2/3 of the tongue. Branches of facial nerve from the geniculate ganglia emerge to The greater Petrosal nerve, this, as I said, carries some of the preganglionic parasympathetic fibers to the Pterygopalatine ganglia, and some test fibers from palatal mucosa emerged from a hiatus in the anterior wall of petras, part of temporal bone, to enter middle cranial fossa, passing forward along foramen lacerum in the floor of the middle cranial fossa, joins with the deep Petrosal nerve, which carries postganglionic sympathetic fibers from the internal parotid sympathetic plexus. Both of them unite and form nerve of pterygoid canal. Now, nerve of pterygoid canal enters the pterygoid canal to reach the Pterygopalatine fossa to terminate in the Pterygopalatine ganglia. Test fibers bypass ganglion and distribute with the palatal pons. And as I said, postganglionic parasympathetic fibers from the ganglia together with postganglionic sympathetic, which bypasses the ganglia, and sensory from the maxillary. They form 4 groups of branches supplying sensory postganglionic parasympathetic and sympathetic fibers to the floor of the orbital cavity, nasopharynx, nasal cavity, and roof of the oral cavity with the soft and hard heart palate. Now, next, in the facial canal, the nerve gives rise to nerve to stapedius, which is a motor for the supply of stapedius muscle, arises behind pyramidal eminence of posterior wall of middle ear, pass through a small canal to supply stapedius muscle of the middle ear. The other muscle of middle ear, which is tensor tympani, we have seen that it is supplied by the mandibular nerve. Because the stapedius arise from second pharyngeal arch, while the tensor tympani arises from the first pharyngeal arch. Then, in the bony facial canal again, before it emerges from the stylomastoid, it gives rise to the chorda tympani branch. The chorda tympani carries preganglionic parasympathetic fibers to the submandibular ganglia, and in addition, carries test fibers from anterior 2/3 of the tongue, emerge 5 millimeters above stylomastoid foramen, ascend to enter middle ear cavity, emerge through that. Passes, as I said, above the tympanic membrane inside the middle ear cavity, emerge through petrotympanic fissure to enter in the infratemporal fossa. Then in the infratemporal fossa, the chorda tympani joins the lingual nerve of mandibular, reaching with it to the submandibular region. The parasympathetic fibers leaves it to rely on submandibular ganglia. From there, the postganglionic parasympathetic fibers from the submandibular ganglia supply the submandibular salivary gland, pass with the lingual to supply sublingual salivary gland in the floor of the oral cavity glands, and then the anterior 2/3 of the tongue. The test fibers of it continue with lingual to distribute to the test buds in the anterior 2/3 of the tongue. As it exits from the stylomastoid foramen, here remains in it only motor fibers. It gives rise to posterior auricular. The posterior auricular arises near stylomastoid foramen, ascend between mastoid process and external acoustic meatus to divide into auricular branch supplying posterior auricular muscle and occipital supplying occipital belly of occipitofrontalis muscle. Next, as I said, it gives rise to digastric, which supplies posterior belly of digastric muscle. Then stylohyoid branch, this frequently arises with the digastric, as long supplies the stylohyoid muscle, which is also derived from the second pharyngeal arch. And finally, the sensory branch of it accompany auricular branch of vagus and supplies external acoustic meatus and partly the middle ear cavity. reaching within the parotid gland on the face. The terminal branches of it emerge. These are the temporal branches, 1 or 2, zygomatic again, 1 or 2, passing toward the angle of the eye, buccal branch above the buccinator, marginal along the body of mandible, cervical branch below the mandible in the neck. These, they supply muscles of facial expression, and frontal belly of occipitofrontalis, anterior and superior auricular muscles, muscles of the eye, orbicularis oculi, zygomaticus major, orbicularis oris, nasalis, buccinator, muscles of the lower lip, mentalis, risorius, and platysma of the neck. So all these collectively, we call them muscles of facial expression. All are called muscles of facial expression. Is it clear? Now, the facial nerve is subjected to a lot of diseases. Now, if you have seen here, the facial nerve passes in the posterior wall of middle ear cavity in this S-shaped bony facial canal. The chorda tympani branch of it enters inside the middle ear. Now, infections of middle ear here, infection, when التهاب الأذن الوسطى, when there is pus inside it with pressure, this might invade into the canal and lead to pressure on the facial nerve or on the chorda tympani nerve. When there is pressure on the chorda tympani nerve, then the patient will lose taste sensation from the anterior 2/3 of the tongue, and there will be decreased secretion of saliva from the submandibular and sublingual salivary glands. The patient will not feel taste in the anterior 2/3. Now, when the facial nerve here becomes affected, and this leads to pressure on the nerve, and this leads to weakness on all muscles of facial expression. This we call it facial palsy, or facial if it is severe injury, and this leads to paralysis or paralysis of facial muscles on one side. We call it facial palsy or facial paralysis. بالعربي سموه شرجي ضربك شرجي بكردي رشباء جنوب بيدرين رشباء جنوب بيدرين شرجي. والشرجي بالجنوب بالبغدادية يقولون أضربك بشرجي، يعني ضربك راجدي قوي كلش على وجهك ويصير بيك شلل العصب السابع. What we call it facial palsy. This occurs sometimes due to severe otitis media as a complication of infection of the middle ear cavity, otitis media. When there is facial palsy, then the patient, the unaffected side of the mouth, the angle of the mouth will be pulled to the unaffected side. إنه إذا هي اليسرى صاير بها شلل الانgle of the mouth تنسحب to the right side. ينعوج حلقة to the right side because there is no opposing muscles to keep it in position. And if you ask the patient to whisper, نقول له صوفر، ما يقدر يصوفر لأنه الهواء يطلع من صفحة ما يقدر يسد حلقة زين. And the eye will be opened all the time. He cannot close the eyelids forcibly. And this sometimes remains the palpebral fissure open. And this might lead to dryness of the cornea لأنه ما يقدر يحرك يسد الجفنين، ما يقدر يحركهم، تبقى دائما مفتوحة. And this leads to dryness of the cornea and sometimes to corneal ulceration. حتى من تقول للمريض انفخ ما يقدر ينفخ زين، ما يطلع من صفحة لأنه ما يقدر يسد حلقة on the affected side completely. All the time there will be a gap a gap on that, and by this you can diagnose the facial palsy. Now another side is where the facial nerve passes inside the parotid gland. Parotid glands, so again, sometimes severe infection of parotid gland might lead to pressure on the nerve. Depending on which branch here it's affected, then there will be paralysis of those muscles. Again, in surgery on parotid gland, maxillofacial, يشتغلون على parotid, they should be very careful not to injure branch of facial nerve, because injury to these during operation might lead to injury of one or more branches of the facial nerve, or even sometimes main trunk, and lead to paralysis of muscles of facial expression, what we call it facial palsy. So the facial nerve in general has 4 components, supplies all muscles of facial expression through its motor component, posterior belly of digastric, stylohyoid, stapedius muscles, auricular muscles, occipitofrontalis muscle with the platysma of the neck. Test fibers contain from the anterior 2/3 of the tongue. Preganglionic parasympathetic fibers for 2 ganglia, the Pterygopalatine ganglia and submandibular ganglia. Through these supply postganglionic parasympathetic from the floor of the oral cavity down to the floor of the oral cavity, from floor of the orbit, nasopharynx, nose, oral cavity till the floor of the oral cavity, with postganglionic parasympathetic fibers, which are secretomotor, in addition supplying the lacrimal gland, the submandibular salivary gland, the sublingual salivary gland, but not the parotid gland. In addition, supplies some sensory fibers to the external acoustic meatus and with the vagus nerve and to the middle ear. Might be subjected for injuries during otitis media, severe infection of middle ear, because it passes in the posterior wall of it, and then might be pressure over it or become pressure during infections of parotid, or injury during surgery on parotid gland, leading to facial palsy or facial paralysis in severe cases. And then, do you have any questions? أحمد.
نعم دكتور.
أحمد أنت شنو رايد؟ ليش خابرتني؟
دكتور على مود التقرير.
على مود التقرير خليت لكم ننزل بالكلاسات كلها ثلاثتها، ننزل لكم تايتلز تقريبا حوالي 45 تايتل يمكن. كل واحد يختار له تايتل من ذولا ويكتب لي تقرير ويدز لي اياه على الايميل.
اوكي دكتور. وكم صفحه دكتور تريده؟
صفحه مينيمم، صفحه واحده، مو اقل من صفحه واحده.
ماشي دكتور.
زين، كل واحد يختار بكيف موضوع.
اوكي دكتور.
من المواضيع اللي حاط لكم اياها، واخر موعد هو 8/7.
8/7 اخر موعد.
8/7 كاتب لكم انتم، الظاهر ما حد بيكون مباوع، ما حد يقرا، ما حد يشوف المحاضرات اللي موجوده هناك.
لا دكتور
لانه صار لي كم يوم من ذاك الاسبوع حطيت التايتلز كلها.
ماشي دكتور، سهله.
وكاتب لكم كومنت انه تكتب تقرير، تختار واحد من التقارير وتكتب تقرير مو اقل من صفحه واحده، واخر موعد للتسليم والارساله هو نهايه الدوام الرسمي اليوم 8/7.
تمام دكتور.
يا كلاس احنا بكلاسي مو ناشر اي شيء،
كلها ناشر ثلاثتها.
ماكو باي كلاس دكتور
هسه اشوف لك.
ماكو نوتيفيكيشن
دوكفو هسه كلاس سي ماكو
دكتور، حتى كلاس اي ماكو.
سووها ملحمه النوب. هسه هذا كلاس سي.
اي
اخر شيء تنزل لي جوا dear second year students, above is list of titles of anatomy reports for second semester وحاطه ويا اخر محاضرات اللي ينزل lymphatic drainage imaging and spread of infection بعدين anatomy reports dentistry work. شفتوها هاي سي
يلا جميل.
موجود؟ هذا بي
دكتور موجود بس التبليغ ما موجود لا مواضيع ولا
موجودة يا ابني ويا اخر محاضرة اخر اسمه تدوس عليه اناتومي ريبورتس.
اخر واحد. اي 55 موضوع.
شلون ماكو؟
موجود دكتور موجود.
بي هم نفس الشيء موجود اخر شيء اخر اناونسمنت ورا السبريد ايميجينج اند سبريد اوف انفكشن موجود اناتومي ريبورتس دنتستري هاي بي. تمام؟
دكتور موجود الملف مكتوب عليه ريبورت.
اي هذا تفتحها راح تلقى المواضيع وتختار واحد منها.
تمام دكتور.
تمام هذا بي هم موجود والاي
ماشي دكتور.
والاي هم موجود والاي هم موجود اناتومي ريبورتس. تكتب انترودكشن عنوان انترودكشن وبعدين تكتب الديتيلز ولا تحط رسم بعد احسن از اب تو يو. مو اقل من صفحه واحده. اخر يوم هو 8 اوف جولاي فكل الثلاث كلاسات كلها بيها اناتومي ريبورتس دنتستري تدوس عليه تطلع لك المواضيع وتختار واحد منها. تمام؟ الكل هسه عنده؟
تمام دكتور هسه علي من بلغ المرحله كلها.
كلكم عندكم. ما عندكم سؤال؟ بالنسبه اليوم خلصت المحاضره؟ اذا ماكو سؤال you can leave and then because I have first year student lecture.